Down in your upper right-hand corner, there should be a multimedia viewer. If you click on that, you should be able to see closed captioning in English. We also have 2 sign language interpreters joining us today. So if you want to use that service, you can pin them in your thumbnail. I'm going to admit this is new to me, and I'm still trying to be able to pin the person.
Thanks very much, Josie. So this is Roger Bearden, Executive Deputy Commissioner, and Commissioner Kastner, you're also with us. I can see you maybe. So this is the quarterly meeting of the Family Support Services Committee, which is an advisory body composed of about 25 people who have been able to join us once again virtually, obviously in the world that we are currently living in. I can see that we have several hundred people who are observing this meeting remotely as well, of course. It's certainly, we welcome any comments that may be offered by those who are in the, I guess, observer status. I think you have the ability through the WebEx program to share information through the chat. Certainly make an effort to integrate those questions as we have the topics that we have identified to address today. So, so there's a question about how can I have access to the captioning. I'm going to go back to Josie for the explanation once again. We're trying to integrate captioning into the WebEx, and so we're just making, Josie, if you can explain that, because I do not have a strong understanding of those technical aspects.
Hi, this is Josie. So if you look at your screen, if you pull down a list of your participants, it'll be on my screen. It's on the right-hand side. I see a list of everyone's names. I then see a box that says chat, and below chat it says multimedia viewer. If you click on multimedia viewer, a box should come up and it's automatic with the closed captioning. You can then drag the box to make it bigger. At the top, there's a little arrow. It says theme, and it says sunrise on my screen. You can change the theme. You can make the font bigger, and you should be able to control it there. Hopefully that's helped everyone.
Thanks. And Josie is listed as host. That's Josie Yankowski. If you're having a challenge with that and you could send her a direct chat as opposed to one to all of the panelists, that might be helpful to triage. Once again, we're trying to do this using the virtual technology. So once again, apologies for any hiccups that we may have along the way. But we are certainly very interested in making this as accessible as we can. So thanks for that question. So let us then move, if we will, to the agenda. Josie, do we have that? Thank you. So we have some new OPWDD staff that are being involved with the Family Support Services. And Abiba, I think you were going to do some introduction of those people, if I'm not mistaken. Abiba, your volume is not working at this current moment. Yeah, Abiba, we can't hear you, so I'm going to maybe ask Alexis and Nicholas to simply introduce themselves, and if Abiba, you're able to figure out your audio issues, we can address that. Alexis?
Can you hear me?
We can. Thank you so much.
Okay, awesome. Hi, everyone. I'm Alexis Harrington. I just started with OPWDD in January before the pandemic madness started. So I am the Deputy Director of Program Implementation with the regional offices. So FSS is one of the programs that I'm lucky enough to be able to oversee. And I will then just turn it over to Nick, who is our FSS statewide coordinator, to just introduce himself. But I'm very happy to be on today, and thank you guys for being able to hop on with us as well.
Nick?
Can you hear me okay?
We can hear you now. Thank you so much, Nick.
Yeah, no problem. This is Nick Hobson. I'm the new FSS statewide coordinator. I started the position in May. You know, I kind of have the same sentiments as Alexis, since she's, you know, newer as well to all of this. I just look forward to getting to work with everyone, learning more about the program, and doing what we can do to move things forward. Thanks.
Great. And apologies, Abiba, that we couldn't seem to hear you. Margaret, as chair of the FSS committee, did you want to offer any initial remarks before we got into the meat of the agenda?
I think I'll reserve any remarks for things that come up as we proceed. I think we should just get into the agenda, and if there are topics that the members of the committee wanted addressed that don't get addressed, I'll remind you and others. Is that okay?
Wonderful. That sounds great. There's a request, Alexis, that went to the panelists, and I don't think you're one. If you could just put your official title into the chat room to all participants so people could have that was missed in the captioning. So folks just want to know what the official title is. Thank you. So there was a request for an update in terms of response to the pandemic, to COVID-19. And sort of the update is one that kind of brings us from where we were in the last quarter. I think as folks on the committee may be aware, we recently issued some additional guidance. Obviously the governor has been pursuing the cluster action initiative, identification of hotspots as indicated by the data reflecting, COVID-19 infections, in particular clusters and microclusters. OPWDD, kind of building off of that initiative, issued a guidance document, I believe it was a week ago Friday, in which we articulated that in zones of high infectivity that there would be a closure of day programming and a suspension of visitation, and that in colored zones which were less than red, there would be some capacity reductions in the day programming. Obviously, the certified residential programs remain open as they have throughout the pandemic, since that is the residential care that those individuals receive. At the same time that we are doing that, we are very closely monitoring the infections as they occur within the developmental disability system. So we have maintained our OPWDD surveillance system, meaning reports of various types, be it new positive tests, be it isolation, be it quarantine, are made through our DQI system, Division of Quality Improvement. We then have a series of actions, including following up with the relevant providers, making sure that appropriate mitigation measures are in place, that testing is accessed, can everybody hear me? I just want to make sure. I'm not just talking. Okay. There's a text in the chat saying that somebody can't hear, and I just wanted to make sure that I wasn't. Thank you. So we have, in response to, one set of initiatives that are ongoing is what I articulated first, which is the the hotspot using the designations that are otherwise supplied by the Department of Health. A second initiative that is ongoing in response to this second wave is maintaining our reporting system and response mechanisms as we see events that are occurring within the developmental disability system. And that has been, I think, something we've been doing for a number of months. There are then efforts. We recently expanded our data collection. This occurred on Monday, which would have been 2 days ago, I guess, in which we are starting to collect data around proactive testing. It's become very important as there's an expansion of testing resources. Then we would be wanting to understand where providers are taking that proactive step to test and what is the outcome of that. So let me pause there. I've given kind of the outline of what we've been up to in the last little bit. Let me give first an opportunity for members of the committee to ask any questions. And I see there's a couple of questions that have made their way into the chat box that will certainly be happy to try to address as well. Margaret, I don't know if you had questions or other members of the FSS committee.
There were 2 items that the members had addressed under this heading. One was updates on the reopening, meaning have there been increased incidences of positive COVID cases since day programs have reopened? Do we know that?
I don't, we have not seen in our data a relationship between day program reopening and increased cases. There have been increasing cases, but that seems to be the growth line seems to match, where it's otherwise been increasing in New York. So, when we reopened day programming, we really didn't see that uptick, and it was certainly something we monitored extraordinarily closely. Right. We did see, but we have seen, unfortunately, an increase in, in cases, an increase in, to some degree, hospitalizations, and so on. But that's really mapping to kind of where, as the state has seen more, that's something that we've seen. So thank you.
Thank you.
Okay, are there any other questions that we want to highlight from the committee members? And I can certainly look at the chat box to see what's there as well. But
this is Margaret again. There was one other thing that we wanted to address, which was we wondered about the demand for new services during the COVID period. What was the number of new families who were served in the last 7 months, and how does that compare with a similar non-COVID period? And what were the types of services that people requested, and in what quantities?
Very much appreciate the question. Let me ask Abiba. I hope we got your audio situation straightened away, and because I think you were going to be the one that was going to address that question.
I believe that I have, Roger. Can you hear me?
Yes, we can. Wonderful. Thank you, Abiba.
Sorry about that earlier. So Margaret, I don't have specific data to share, but I can certainly note that we have continued to authorize services throughout the pandemic. We had a number of folks coming in through the front door from folks who were, graduating out of their local school districts. Certainly we put in place a plan to ensure that those folks who were seeking a change in their services could access those changes through the service amendment process through the front door. We've continued to see folks requesting, community hab. Some folks were requesting to change their day hab services, respite, et cetera. We've implemented a number of flexibilities as a result of the pandemic, and so those flexibilities continue, and so individuals were certainly able to avail themselves of services from their existing provider through those day service flexibilities that we had previously outlined under the Appendix K. I think in a previous meeting, we had noted that there continues to be work on our IT data system, and in a future meeting, we'll certainly provide very specific updates in terms of what those changes are and what data sets we'll be able to produce for folks. But I certainly want to point out that we do have utilization data on the OPWDD website. We can send that address to folks if you want to take a look at the authorization of services, et cetera, that we've included on the OPWDD website.
Thanks, Abiba. And I would add that I believe we noted on a previous meeting that we did see a downturn in people entering certified residential during sort of the March, April, May period. Certainly that's a number we track, and that was not a product of the lack of OPWDD administrative processes. It was much more a function of providers obviously needing to care for the individuals they'd already committed to and needing to, I think, safeguard their resources as we were in the midst of that, a very, very challenging time. So we did see, that folks were looking at, not a lot of providers were looking to accommodate individuals. I think once we hit the summertime and we had, fortunately, a great diminution in the amount of, COVID-19 in the state and also in the IDD system, that activity has picked up to some degree. If I'm not mistaken, Abiba, I think that's been true.
That is accurate, Roger.
Margaret, are there any other committee questions before I try to maybe ping a few of the questions that have emerged in the chat room?
I think we've covered everything. Thank you.
So there's a question, and I just won't read out the name of the person because I think that's unnecessary. Are there any guidelines regarding ongoing testing of residents and staff of group homes similar to that of nursing homes? In our most recent guidance, we strongly encouraged testing. It's something that we've been very supportive of as a measure, as a proactive measure, but it has not been something that has been required as it has been for the nursing homes. There's a question about is there any discussion to extend the accommodations for school opening within the red-orange zones to day services? I think that question, if I'm not mistaken, is referring to recent guidance that allowed for schools to reopen if they implemented their own mandatory testing regime. So, our closure of day programming was similar to the closure of schools in these high infection zones. Yes, we're aware of the guidance. We're looking at it. We haven't yet made a determination or recommendation as to whether that would be the course of action. But the short answer to the question is yes, there is discussion of that topic. We just don't have a conclusion. I became aware of that guidance fairly recently, and we're looking at that as a possible model. Or there's a question with regard to if a staff is symptomatic, can they be required to get testing? Jill, I believe, Jill Pettinger, are you on the line? I don't know if we managed. I believe partially that's an answer of it is recommended, and Abiba, I don't know if you could address it. It is recommended as part of our containment guidance. Whether it can be required, I believe, is an employment question that relates to the rights of an employer to command an employee to do something. But Abiba, I don't know if you have a good answer to that question.
Yeah, I mean, Roger, you captured that. That's essentially the guidance that we've been giving folks. At this particular point, there isn't a mandate, right? But so I think you captured it, Roger.
And so there's a question about how long will day hab be closed. So that's an excellent question. So right now, day habs are only closed where the zone designation requires that closure. Once the zone designation becomes, I don't know, a brighter color, a non-red, a non-orange, becomes green, then day habs would be authorized to be open. So it's hard to make that prediction because it requires foresight into how well or poorly, how long those zones will be maintained. I would note I saw that one of the zones that was red in the Mid-Hudson Valley did become orange. It's a product of the data. So our guidance it seems to tracks where the data reflects a zone should be designated. So as those zones become better, then the day hab would be permitted to reopen. I'm just looking through here. Deb Greif, do you have a question?
Okay, let me get my mic.
We're not hearing you, Deb. If you can try.
Can you hear me now? Can you hear me now?
Yes, thank you. Yep.
Okay, welcome. This is my question. Due to the fact that many of our individuals have trouble with testing, especially the quick test where they use the long swabs to go in their nose and many will not allow it, even if they try the short, is the Article 16 and 28 clinic that serve our population, are they able to do the test or work with the local government to make sure our individuals can be tested without being possibly traumatized?
So the words were coming in and out a little bit. I'm sorry for the audio connection was a little, it could have been my poor.
Can you hear me again? All right. In New York
Much
City,
better.
in New York City, the New York City Department of Health through the Mayor's Community Affairs Unit is going around seeing our individuals are tested. Many of them, and the parents have told me, they will not let the long swab go in their nose. They try to do the short swab, which can be used too, but many won't allow it. So what we're asking is, are Article 16 and 28 clinics assisting the local Department of Health or government run clinics to make sure our individuals can be tested without being traumatized, if possible?
Gotcha. Well, yeah, well, I'm aware there have been a lot of collaborations in different parts of the state to try to make, leverage testing resources. I'm not familiar with specifically what the Article 16 and 28 clinics may be doing in New York City. I don't know, Abiba, if that's something that you have some insight on, or is that something that we need to, to take back?
I think, Roger, that's something that we need to take back. That's not something that I have intel on. So I will make a note and we can discuss that further.
I just want to add
Thank you very
something
much.
That the Brooklyn Femmes Advisory Council with the Queens and Bronx Advisory Council, we had a joint town hall meeting, and the mayor's office liaisons do want to work with OPWDD because we brought up these issues and we don't want our individuals hurt or traumatized when they try to test them. So I will forward all the information to Abiba, and of course Albany is Margaret, so you all have the information, but they do want to form partnerships to help.
Okay.
Okay.
There's a note from the ASL interpreter. If you could send a message then to Josie Yankowski, she'd be the person who can give you whatever technical assistance that you can get if you haven't already connected, because I'm not sure that Josie is a panelist. Okay.
Roger, this is Ted. I just wanted to make a comment on the testing issue. We don't regulate the testing function for 16s, and 16s would have to be approved to provide laboratory testing under the what's called CLIA, the Clinical Laboratories Improvement Act. That is a separate regulatory process that, again, we're not involved with. So some 16s have expressed interest in developing testing capacity. Others have not, but there's no policy at our level about doing that. And I would suggest if people have difficulty with the nasal swab, that there is a saliva test that's also available for testing purposes. So that would be another option.
All right. I think I have, thank you, Commissioner. I think I've tried to consolidate as many of the comments as I could into questions. I'll try to sweep back at the end to see if there's anything that we've kind of left out. But I do want to perhaps keep the meeting going. There have been several questions about subsequent to this meeting, where is this posted? What will happen, and it's dependent upon the pace of our transcription service, but basically what happens is over the next several days there will be the transcript would be posted to the OPWDD website. We have a section for public meetings, and then typically the video is posted on our YouTube channels. That is, let me move. So there's a few more testing questions. The current guidance is that it does not mandate testing, but strongly encourages that testing. And many of our providers have been able to leverage testing resources, obviously with the caveat that Deb Greif, offered. And so that is the current state of play. Let us go then to budget matters. Once again, let me go back to Margaret and ask you whether you want to give any intro as to some of the key questions that members of the committee were interested in addressing.
Sure. We wanted to know more about the 20% withhold on state-only funded services. And we wanted to know if you have any data on the impact, financially and practically speaking, of the withholds. How will they affect the agencies? How are they affecting families who need services? We wanted to know the state budget for family support for state-funded services, not only family support, for state-funded services and for family support services. And what is the projected spending for this year and next year?
Okay.
We wanted to know, do you want me to go on or should we just deal with them?
Yeah, I think it's, I think it's good to, I know what your list is, but the people who are here observing us do not. So it's important to make it a coherent dialogue.
Okay. We also wanted to know what have been the impact of the budget cuts on self-direction participants. And another question that keeps recurring that we really would like some clarity on is what happens to any unspent FSS money? Are some contracts paid in advance? And if so, what happens to that money if it's not able to be spent during COVID?
Got it. So a lot there, and I'll try to give an overview. And Kevin Valencius, our CFO, is with us. Kevin, you with us?
Yes, I'm right here.
Okay, so why don't I try to give an overview of kind of where we're at, and then we'll kind of give some. Kevin can help fill in some of the details on the outline. So I think when we're referring to the 20%, we're referring to a withhold that was applied to certain categories of state funding, meaning non-Medicaid funding. For reference point, OPWDD in aggregate spends approximately $400 million on an annual basis in state-only dollars, and there's a variety of categories to that spending. FSS, I think, is about $52 million, somewhere in that range. And we have a number of, items, including, individual contracts we may have, et cetera. There were, that included in those monies are ISS, which is our name for our rental subsidy program. That was when the withhold was initially announced sometime in the middle of the summer. we were that was initially included in the withhold, and then we were able to exclude it so that, and it's a quarterly withhold, so we were able to maintain that exclusion with the quarter that began 10/1. So that's the third quarter of the fiscal year or the fourth quarter of the calendar year, depending upon how you look at things. And so we've been able to maintain that. The withhold is exactly that. It's a withhold of payment, not a cut. And the message has been rather consistently, there's a lot that matters on a federal level as to whether or not there's sufficient support, for states, for localities coming from the federal government. This is the first public meeting we've had after yesterday's election, but I think the question of what the consequence of that election is for the future of those kinds of monies is as yet unknown. So right now we are maintaining those withholds. That's a consistent policy that has been applied, across state agencies. It's not unique to OPWDD. And we kind of are in a bit of a holding pattern, waiting, I think, for further guidance, both from the State Division of Budget, as well as obviously whatever may be happening on a federal level that may be impacting state decision making. So that's the framework in terms of the what. I believe there's a question about sort of the impact, and I'm not sure entirely how to answer that. And Kevin, I don't know if you have a sense. I don't think we have a formal kind of analysis to say exactly what's happened on the ground. We do know that this has led naturally to a reduction in the amount of service that people are going to be able to receive, but the exact who, what, where, we're not that far into the initiative to be able, I think, to precisely answer that. Kevin, is there something you would either elucidate or correct in the outline that I just gave?
No, I think Roger, you were spot on with your numbers. We do average around 50 to 52 million bucks a year in family support services spending, and that's been fairly stable, I think, over the last 4 years at that level. And we do spend upwards of $400 million rounding up annually on our 100% state pay budget, Margaret. So that should give you some context about, I think it's roughly 13-ish, 12-ish percent of our total, 100% state pay spend is on family support. I think, Roger, to your point, we know, we've either actively withheld or will be withholding from payments, I think, an aggregate of around, $13 million since the initiative began. So that does show you that there is a financial impact to our providers, but in a more nuanced level, Margaret, we don't have any specific analysis about, how this impacts people who may be self-directing versus those who, have agency-directed services, versus those individual, versus, the broader, provider base. So we don't have a micro kind of nuanced look at this, as Roger said, yet. I do think that one of the major areas that we're still in the process of analyzing is, we did look at the financial viability of our provider network at a snapshot point in time. In early, I think it was in May, we had communicated our intent to get some initial high-level cost report data from the providers. We had about a 90-ish, I think, if the number is not greater than that, percent rate of return on our CFR schedules that we wanted the agencies to submit to us. So in the aggregate, that was a look to try to understand, the revenue situation of agencies, but it wasn't, specific to family support, nor was it really specific to OPWDD. When we got those broader financial statement data, It was really about the provider in its aggregate and in totality, so all of its lines of business, whether it be OPWDD, MH, or other SED, state education programs. So I think that's the only area that I'd, kind of elaborate a little bit more on, but that's the information that we have at this point in time.
So Kevin, thank you for that. I think I want to give an opportunity for members of the committee to ask any follow-up questions. There's some questions in the chat room that I'll try to summarize, but Margaret or other members of the committee, if there's anything that you all want to ask by way of follow-up.
Could we just circle that question of unspent family support dollars? What happens, and is that a function of some of the programs, some of the contracts being paid in advance?
Yeah, I just want to make sure that folks on. Oh, sorry, Roger, were you gonna?
Right. Well, I was going to maybe answer a little more broadly, and then Kevin, you can answer it more specifically. I think one of the things we've heard from a number of venues is that part of the consequence of what's been happening, in the last 7-8 months, has been underspending in certain areas. There's also been a consequence of overspending in certain other areas, and so, we're still really not certain in whether. I'm sorry, somebody's got a mic that's creating. So we're looking at those kind of puts and takes in the sense of, so we closed, for example, day programming, shut that as we know, for a number of months early in the pandemic, but which ought to lead to an underspend in that area. However, we also paid a retainer day program, which that had the purpose of sustaining providers with additional revenue. So to the degree to which there would have been underspending, that from a state perspective, that's the spending occurred. It just went for the retainer day program. So figuring out with some precision exactly the interrelationship between those factors that caused additional spending and those factors that caused reduced spending is still a little bit unknown. We're particularly because there's a 90-day, up to 90 days to be claiming in the Medicaid program, which is far and away our largest, expenditure source, and those timelines were actually extended in the response to the pandemic. So, making firm predictions at this point about exactly what the cash we plan to spend this year is compared to what the cash that's actually been spent is actually quite challenging even now. That relates then to the question of the FSS dollars. And Kevin, I don't know if I've set you up or taking you into a different direction, but I wanted to give that larger context.
No, you're right. I mean, I think at its macro level, there's a lot of puts and takes that have been going on in terms of investments versus, let's just call it underutilization, related to the impact of the pandemic on our supports and services. With respect to, family support services, I mean, you guys know, right? And I think the stakeholder group has had this conversation, that at some point it's quite possible that these 20% withholds could morph into a permanent cut. Again, depending on what we see, happening down at DC, depending on who's in office, et cetera. I don't want to, speculate about that. And, realistically, first and foremost, I did see a question pop up about reallocating unspent monies. I mean, I think from this year's perspective, if the spending didn't go out the door, there's no way that it's going to go out the door this year. And and that's what Roger has, alluded to and said, we're really trying to get a better handle on what this, underutilization is generally, and then specifically in 100% state pay versus Medicaid, because honestly, let's just be honest. I mean, I was watching an Office episode when Michael had a budget a couple, months ago, and there was this notion that he would lose the money if he didn't fully expend all of his resources. That's not what happens with OPWDD, right? If we don't spend money this year, we're clearly going to make an assumption. And I know your second stage of that question, Margaret, was what happens, how do we think next year is going to be? And I think that, trying to even finish this year is complex. I think even a normal year is complex based on, the cycle that we get in terms of when providers invoice us for the services they rendered. There's a natural delay in a lot of that that we've seen, which is why we kind of gave you that average expenditure or actually spending disbursement on family support services, because it does vary year to year depending on timing primarily. But, from our perspective, I think that if we have to absorb or are directed to try to manage within a formally reduced cash allotment this year, to me, I'd rather, give up and identify the underutilization of not only family support, but other Medicaid services to avoid the need for a long-term change, whether it be a rate change or a contract change. But that's something that we're really trying to assess now. And again, depending on how we, manage that year to year, you may have an impact next year, you may not. From our perspective, we're beginning to look at next year as if there is no impact to COVID, because I think that, related to COVID, because that would be the most conservative approach in terms of total dollar, dollar need. So, I think that what we would be projecting is next year we're going to spend that average of around $52 million, in family support again. Whether, that happens this year, I think is definitely a different story. And what I would say is, to me, rather than looking to formally eliminate contracts or, change provider Medicaid rates, I think the easiest thing is to identify where we have some underspending that we would not be able to reprogram and get out the door this year anyway. So, I mean, that's just my honest, position of what would happen. But I can say that, if let's just say we don't spend 10 million this year, and at the end of the day, the family support is 40 million, 42 million to make the math even. Again, next year we're planning that we would be back up to that average, at 52 million. So it's not like that this is going to be permanently lost, at this time, unless, as Roger alluded, things don't happen out or go our way at the federal level and the state is really facing a significant cut. I mean, I don't want to sound like a broken record, but when, the budget director's call letter did come out, it's on DOB's website. They're looking for 5% below flat. So that really means 5% below current year levels for our funding request. There still may be additional impacts that come through, depending on what does or doesn't happen as a result of the, the federal activity, the election and at the national level. So, that's probably the best case scenario at this point. And I would hope it gets better, but, that's really kind of what we're beginning to plan around, is what would in essence, a 5% reduction look like. And that's just, where we are today in terms of, the financial impacts of COVID on the state budget, budget level. And I think that, the enacted financial plan update that came around back in the end of August, around the time we released the letter about the withholds, there was roughly a $65 billion 5-year reduction in general fund revenues. We're funded by the general fund. So, just like all the other agencies, there's a pretty sizable potential impact here, based on that long-term structural, effect of COVID on the economy. So I don't know if that's answering or maybe too much information, Margaret, but, the short answer is you don't lose it if you don't use it. And we'd always look to, we're trying to be as aggressive as possible in our assumptions to make sure that, we're able to try to, return as quickly to pre-COVID levels as possible. But we all know that, the budget crystal ball, which doesn't really exist at this point, is going to be, different than reality. And that's what we just have to kind of manage through together.
So in the chat room, there's a question regarding kind of what are the categories of spending for state only, and I'll just kind of give an order of magnitude. So I'll start with the highest one and then do it sort of in descending order. This is last year's data. Our percentages kind of stay relatively similar from year to year, and so the number one state only supplement is a supplement we pay above the SSI to supplement room and board costs for certified residential. That's about 23%. FSS is about 12%. once again, using around a $400 million, total. Then you get self-direction, which is around 12%. And that self-direction, the way, we don't see the difference between various it's all the state-only components of self-direction. So it could be a housing voucher, it could be OTPS, it could be any of those things that we pay 100% state funds for. We pay about 11% or so of that for aged out individuals, people who are who remain at their educational placement beyond a 21st birthday, and for whom there's 100% state pay. And then we have, and the housing subsidies are a little less than 10%. That's the ISS. So that would be people getting housing subsidies, not in, not in the self-direction program, because those numbers would be reflected. We don't have an easy way of pulling out because of the self-direction program design. It's just a PR. It's just a budget. And then it kind of goes down from there. There's still some money in state aid contracts with counties. There's some money in transportation, right? So if we're paying, and then there's contracts, one-off contracts, maybe with an accounting firm or so on, those kinds of things. But the major categories are what I articulated, and there were some changes in last year's, I think, budget to the state supplement on SSI, which may have reduced this year's percentage. So, but generally those are the categories, and that's the where we spend the money. So I hope that's responsive to that
Thank
question.
You.
Kevin, Kevin, I was pulling up a chart from a few months ago.
I have a question, please.
Yeah.
Okay, I sent it to you, Roger, but you didn't answer it. My question is,
okay, I'm sorry.
We have agencies in our area that have stopped doing family support totally. They just dropped their contracts. So what is going to happen with those monies? They're not being spent by the agency. Will they stay in our area and eventually we can reallocate them, or are you going to take them back to the state? Because it's a significant amount.
Kevin, I don't know if you want to answer that.
Yeah, I mean, I'll take a stab at it. I mean, I think what we're doing is trying to, one, I'm not aware of all those types of activities, and I think that's something that we're trying to get a handle on. I know in past stakeholder calls, there was a reference made to providers taking a myriad of actions. Most notably would have been to actually reform how they use the state dollars in contract to really generate some efficiencies, because they understood that the state was facing a significant financial challenge. I think it's hard for me to honestly to answer that question right now. Would they stay in the region? One of the things that we are working with is internally to try to understand priorities for a myriad of investment opportunities. I just think that we have to, I can't say definitively because I don't know what the budget is going to require of us going forward. We all understand the need to ensure the provision of supports and services is the paramount reason for these contract resources, and that's something that we want to make sure that we're looking at to preserve that capacity. Will any program look like it does or it did pre-COVID over the next several years? I don't know. Our goal is to minimize the disruption as much as possible, but when we're part of the broader general fund utilization and resource allocation, I mean, I think it's fair to expect that we're going to be asked to identify efficiencies, and some of those efficiencies, minimally for the short term, could be sunsetting of certain contract requirements. The goal would be over the mid to long term to make resources again available to make sure that we're meeting everyone's needs as effectively as possible.
These agencies dropped them before COVID, so it wasn't necessarily had to do with COVID. So the monies are just not being spent on families. So
Yeah, I would say that where we are in the financial picture, that we're not looking at over the short term to procure, those types of contract arrangements at this time. I mean, we are facing a fairly significant, challenge, I think, going forward, but, anything can happen, as part of the budget process. And I think that we're just at the infancy of its beginning and just don't know for certain what we're going to be asked to do fiscally.
And I would say that there's also a component in, there's a few notes in the chat. What we don't know, and we can communicate what we don't know as well as what we know, is once the situation is resolved as to whether the withhold would mature into a cut or not, there may be opportunities then to to work with the agencies to be able to figure out what the way to accommodate that is in the way that makes the most sense. I know that's been something that's been raised in a number of fora, but we really do need that decision point resolved as to whether or not the withhold is just that, a cash flow management exercise that then, we make up the 20% that have been withheld, or is it a cut action, in which case, there's other types of, I guess I would call it creativity. I can't find the right word, but other kinds of measures that could be taken to, to help do that. There's a question that I'm sorry, and for those of you who thank you for reiterating the question. The chat has been going quickly, and my ability to quickly absorb that and give voice to your question. There's a question that I think goes back probably, and Abib, if you had an opportunity, someone's just asking a generic question about how long it should take for someone who started the eligibility and waiver eligibility process. How often does that usually take for someone to process through? It's a question from somebody in the larger world.
Unfortunately, Roger, it really depends, because we have some folks that reach out to the front door, but they don't have the appropriate evaluations, and so they need to go back and have those done. We know that Medicaid eligibility is also a challenge. So I think that I'm not sure who asked the question, but if there's a specific case that folks are having difficulty with, if they push that information through, we can have the regional office follow up.
Yeah, and so for that questioner, if you wouldn't mind, Josie Yankowski is the host. I don't want to include everybody's personal information in a larger forum, but if you want to push a private message to say how someone could get in touch with you, we'll make sure to have somebody follow up to make sure that we're addressing that. Any needs that you may have. I have a quick question.
This is Alia.
Sure. Hi, Alia.
Yeah, I've been trying to, I can't turn on my camera, so I'm sorry about that. But my question, Roger and Abiba and Kevin, is there is money already with the family reimbursement services with certain agencies, but they have the criteria of reimbursement for clothing or reimbursement for the transportation. Is there a limit of service from OPWDD, or they pick up their own reimbursement criteria? And if that is so, can OPWDD suggest to them to reimburse for respite services? Because this is a historic occurrence that happened, that the kids are in the home, and this for this long, it's never happened before, and the parents really do need at-home services. So if what can OPWDD do to get that funding to the families who really are in need?
So, Aaliyah, this is Abiba. I mean, so the criteria of each of those contracts and programs were developed by the local council reps, in concert with the FSS coordinators. So if folks are finding locally that a specific contract no longer meets the needs of the individuals, then those are the types of issues that should be discussed when folks are engaging in the review and the performance metrics of those contracts. And there should be discussions about either adjusting those specific criteria or speaking with the provider about what the local needs are. And there's a mechanism to accomplish that.
So basically,
Okay.
it's between the provider and the family, right? Nothing to do with OPWDD when they pick up
No.
what they want a reimbursement for.
No, that's not what I'm noting. What I'm noting is that when those contracts were developed, it was developed with the input of the council reps, the FSS coordinators obviously facilitating, and a discussion with the provider about what the local needs are, right? And so if the local needs have changed and perhaps the provider has a contract where they're funding components that no longer meet the needs of the folks locally, what I'm saying is that when the FSS coordinators and the council conduct their review of the contracts, then that's an opportunity for discussion with the provider about, looking to change, what they're funding so that they can better meet local needs.
Oh, thank you so much, Abiba. Thank you.
Hi there, this is Gail Pado. Can you hear me?
Yeah, we can. It's a little bit faint, Gail, so I don't know if you can get a little closer to the mic.
Is this any better?
Much better, thank you.
Okay. I actually have one question to just build on, and my own question that I'd like to ask separately. The individual that had asked the question about the length of time that it takes to get services, that was actually much more of a general question. The assumption is that the person has all of the documents needed to submit for eligibility and services. So do you have any data on that length of time that it's taking for someone to be approved?
I don't have the data immediately available, but I know that with eligibility, we have a 3-step process that essentially takes about 90 days if, in fact, all of the documentation and evaluations are provided to the regional office eligibility staff. But that's just for eligibility. That doesn't include waiver enrollment. It doesn't include enrollment into CCO. It doesn't include service authorization, and it doesn't include the identification of a provider to provide that service. That's just eligibility.
Okay, thank you. Also,
You're
back
welcome.
when funding FSS cuts were first mentioned, we'd asked some questions about data that was being looked at to help inform those decisions. And I know we've asked for data several times since then, but we don't seem to get it. And I'm wondering, even submitting questions in advance, I'm a little concerned. We're hearing something about a problem in the way that data is being gathered currently, and there is not yet an analysis of how people with disabilities are being impacted by the withholds. And I mean no disrespect, I'm very confused. I'm just curious, what is guiding the decisions that OPWDD makes, and how do you get feedback about people being served and how that's impacting them so that we can do our best with the funds?
So I'm not sure. There's a lot that's kind of layered into that question, Gail. First of all, in terms of the Family Support Services Program, I believe at a prior meeting, I think it may have been 2 or 3 meetings ago, we did provide a breakdown of categories of spending on FSS that, and the challenge, the merit of the program is it's been, a very localized program. But what that meant is that when we were trying to aggregate and say how much of the 52 million or so is being spent in broader categories, it really did require quite a bit of work in terms of hundreds of contracts to look at, which were all administered on a local level. So I think that piece of it, and what we identified is areas where there were potential lack of duplication of resources, and I think we talked about that in a couple of times as possible areas for reform. In terms of the withhold, we do know that the agencies have applied that in different ways. So there have been, I think there's been a diminution in certain types of services that have been rendered through state-only dollars, FSS being one form. We certainly know that. The question that I think is hard to answer is, what is the end impact of the loss of X service for a period of time, or maybe the reduction of that service on the individuals served. It's not something that can be easily answered in real time. Obviously, one can assume that that would be a negative impact, but how much and to what effect, it's a little harder to answer. So that's the question that I think we were struggling to say give real data on. In terms of our evaluation and discussion about sort of, I guess, choices, we have been working with a number of stakeholder entities, including these discussions, to try to understand as best we can where our various stakeholders find priorities, where they feel that if there's an opportunity to invest, where should those investments be made? What are the most effective investments? If there's a necessity of cuts, what are the types of cuts that are, I guess, least damaging to individuals? So that's, part of our data source is actually these kinds of discussions where we try to learn, how to make these decisions, which are often quite difficult decisions. They're decisions being made between some bad options. And as I think, as Kevin was articulating, the fiscal picture right now, as articulated in the budget director's letter, is not positive. It's calling for a 5% cut. And so that's something where that forces really challenging choices. In terms of, there's a question about ability to participate in OPWDD services during school hours for school-age children. And I could stand to be corrected, but I believe there continues to be a federal policy that prohibits HCBS waiver services where there are school-age educational services that should be delivered during that time. The concept is that Medicaid is the payer of last resort. So there's a CMS policy, Center for Medicare and Medicaid Services, that establishes that policy, and then I believe there was a Department of Health policy document to implement that here in New York State, applicable across all the waivers, whether it's an OPWDD waiver or a TBI waiver, or whatever the other waivers that it might be applicable to. Abiba, did I capture it right? I'm just looking at you. You're pinned on my little screen above.
You did, Roger, and that Department of Health notice is posted on our COVID landing page on the OPWDD website.
Thank you very much.
Yeah, hi, Chris Collega. I just have a couple of questions, if that's all right.
Absolutely.
I think the point I was trying to get at with regard to how the 20% withhold is affecting agencies, I was mainly wondering initially if there was any research or any attempt to quantify and understand the impact that this was going to have on agencies actually prior to the cuts being implemented.
Well, this was an initiative that was, I think, rolled out across all state agencies in real time. So that was something where, given the critical nature of the state's cash position, it was something that needed to be rolled out in real time. So the answer to that is no.
No. And you're not aware of any of such research that might have been done at Division of Budget? They didn't come to you asking, say, we're planning on.
I'm not going to speak to what the Division of Budget may or may not have researched. I'm just saying that we had a good idea of where we were spending the money, and we had a good idea of how to apply the withhold. But we didn't have the luxury of many months of analysis to given the fiscal situation in the state.
Right. Okay. So. I'm kind of going to assume that when we get to the trade-off between the additional costs that have been caused by COVID and these savings from the services that have not been rendered, I'm going to assume that that's probably a net savings when the analysis is said and done. Is there any kind of time frame where you think you might have a better handle on what that number is?
We are probably going to have a better sense of that closer to the end of the year. I'm not sure that I would agree with your assumption, though, because there's an area where, one of the things that we authorized during the course of the pandemic is this ComHab-R, so the rendering of community habilitation in the residence. As folks were not able to leave the residence and the residential provider was providing services, you do have this opportunity that a day hab service provider that may be receiving a payment, to maintain them as a viable business, while at the same time the individual is receiving services in the home. That would be an area where you could end up with a double payment. It's not quite twice, but you'd have paying twice, whereas previously you'd paid once. So there could be overspending there. We had a lot of people, the people who were living at home might not be getting the same quantum of services that they would have at a day program, but we offered flexibility, billing flexibility, which would allow for 1 hour of service provision to be paid for as if it was two as if it was 4. So that obviously helps sustain revenue to the day hab provider, but from a state spending perspective, it becomes, there isn't a savings because of the underutilization of service may not be accompanied by underspending, if that makes sense, Chris.
Yeah. It depends on where that all washes out once you have the data.
Yeah.
So I think the only other comment I'd like to add at this point is there was some discussion about we may have to look for areas where we can specifically target to make some cuts down the road and save some money. I just think it's really critically important that we involve people that are closer to the ground in those discussions and really take a serious look at their input, because I think it's a real valuable information to have, and I think it'd be very helpful for executives to have a look at the people on the ground who are actually a little closer to it. Thanks.
No, absolutely. We're very much trying. I mean, there are limits, obviously, about the ability, given, look how we're doing this meeting. None of us are in a room together, right? It's just, some of the kinds of outreach that you might like to have, in normal life is not possible. But absolutely, to the degree to which we can get, the best understanding of where the priorities lie, and certainly over the last several years, there's been a very strong voice around being fair to direct care, around the importance of the direct care workforce and the need to sustain and support wages for that workforce. So that's something that, obviously, as we think about priorities and difficult choices, that's something that a value that we certainly hold dear, and we've heard from broad swaths of the larger community that we support, that's a very important value to preserve as best we can. Crystal, I believe you have your hand up.
Hi, yes, thank you. I just wanted to know if Dr. Kastner and everyone else was aware that FSS saves OPWDD money by supporting individuals to stay at home with family versus putting them into residential settings, and that having this 20% withhold being placed on FSS, that is actually harming families as a whole, because programs like family reimbursement, a lot of agencies, almost all of them that I know of in Western New York, are no longer offering family reimbursement itself. And so that's going against the savings that somehow you're trying to create by having a withhold, which might ultimately become a cut. And another thing that I wanted to mention too is the fact that having this withhold, if it turns into a cut, many agencies are not going to be able to come back from it. And there'll be agencies that will be forced to close because they do not have this funding. They don't have this extra money. They can't get loans for money that they're not going to receive back to be reimbursed. So we're going to lose services overall because of a withhold that turns into a cut. So that's why I know a lot of agencies are no longer offering things such as family reimbursement, and they're no longer offering services that support families. And I think the ultimate goal is to have everyone recognize the importance of having family support services in place, because we are preventing extra cost of placing our family members into residential, which will ultimately cost the OPWDD and the state overall a lot of money. So even placing a withhold on this program is quite counterproductive. And I wasn't sure if everyone is aware of the fact that it is counterproductive and it's harming families and making it more likely you're going to increase costs by at least twofold by having individuals placed into residential because families can no longer afford to keep their family members at home.
Right, and I think, you know, Crystal, I think it's understood that there are, I would say, these difficult trade-offs. So certainly if a dollar spent to divert, you know, a more institutional placement ends up costing you $2, $2 of care, you're not really saving that. And I think part of what we're trying to understand is taking a holistic view as we look at, you know, the withhold. I absolutely understand what you're saying. You know, that's something that has been applied really as a cash management tool. But as we're looking at the kinds of trade-offs that need to be looked at as part of the budget making process, the question that you're raising is a really, really important one. We would be saying, if we were to reduce spending in an FSS, would we drive spending somewhere else? If we were to increase spending in FSS, would it reduce spending somewhere else? You know, obviously that there's a lot of premises that, you know, that you have to get into to be able to evaluate that claim and make sure that you're confident about your investment yielding the return you want. But the point is well taken. You know, the same kind of point is made with, particularly with crisis services, you know, where investments in prevention can be really, really important to avoid hospitalization, avoid, you know, institutional placement, et cetera. So it's a good point, and it's something that we'll take it to heart as we look at the budget making.
Thank you. I appreciate it.
I just want to add to Crystal's question. Crystal, the PRA freeze has been lifted. It was last week when there was a letter sent by the self-direction department. There is no withholding and self-direction. The PRA, whatever the remaining is on the service amount, it's available. So that has, I don't know how you are discussing about withholding, but we can talk more, Crystal. I'll call you. Take care. Bye.
Roger, can I ask a question?
Of course.
Yeah, sorry. I don't know if I'm on screen or not. I was having video issues.
You are.
Okay, well, that's great. So this came up about a year ago. I had asked this question, the last in-person meeting, I believe that we were all lucky to have. Region 3 had an RFP in play, which apparently had, quote unquote, been approved. I believe Abiba had told me that it was, and it was somewhere in the budget committee. And most of it was earmarked for crisis intervention, which quite frankly, we could all utilize at this point. In any event, that RFP was, quote, frozen. Now, we'd like to understand, does that mean permanently gone? Money that we have been for 2 years trying to put out into the community, that was an identified priority in our community. And to the 20% withhold, it seems as if it's arbitrary in that there is no regional analysis as to what region might have greater needs than others. And in our particular case, that crisis money was very, very important to our community. So how do we, going forward, one, do we get that RFP money back at some point? And two, how do we ensure that regions have a more decisive involvement in potential cuts, so that it's not just across the board, but much more geared towards where do we have duplication of services? That look-see that was done seemed that it was much more global, statewide, as opposed to regional. So it's a lot of questions thrown into one.
Yeah, I have to admit I have absolutely no idea about the Region 3 RFP. So I would ask whether Aviva or Alexis or Nicholas may have some insight on that. And if not, I think we'll have to take that offline. Any of you guys have any?
Yeah, Roger, this is Aviva. I remember Maria noting that there was an RFP. Maria, I apologize. I don't remember noting in a meeting that it was approved, but we can certainly go back and have a discussion with Region 3 to see what the status is on that. But I think we just have to I just have to harken back to what Kevin noted in terms of, really looking at all of our services across the board. I know that you mentioned that this is a crisis service, but I think we have to sort of dive deep and look at, what was being proposed and which providers were proposing to deliver it, et cetera. And again, whether or not it meets regional needs, taking into context all of the information that Kevin provided about looking at the budget and looking at all of the contracts across the board. So I will take that back, and Maria, I will make sure that I have a response for you. I just need to look into that further.
Thank you.
And then Maria, you had another question, which I didn't want to lose, but I've now forgotten. I'm sorry.
So to Aviva's point also, I would hope that the look-see in terms of what the needs are developed on a much more local level. I know Chris spoke to that as well earlier. I understand there are budgetary constraints. We all get it. We all feel it. But I think the needs vary from region to region. And it's not just a matter of saying, okay, X amount of dollars can be cut from the, 52 million FSS money, when one region may be able to let some money go and another region may not. So that was kind of a statement / question, like, what are your plans going forward in terms of how you're going to take another look? You did present that chart, but we never really definitively heard back as to what the plan of action was going to be. And I'm guessing it's because COVID got in the way. So, so I'm wondering at what point would we, reopen that conversation so that we know where those cuts down the road will actually be coming?
Absolutely, and absolutely, yeah, I think because COVID got in the way is a good explanation for many things these days. So just the rhythm of where we're at, and I believe we do have another FSS committee meeting. It could be as soon as next month because our quarters got kind of squeezed.
You're absolutely right in that.
So, if you read the call letter that came from the division of the budget, it asks for sort of some preliminary ideas in the next couple of weeks. We typically, do not get super granular, and those are internal conversations. But if in the event that, we are looking to achieve some savings in the, in the called the state-only spend, which FSS is one component, we would have I think a sense. I think we'd be able to say, these are some areas where we would think would be higher priority. There's some areas where we think might be kind of lower priority. I think we would welcome, certainly from the FSS committee, any guidance you might want to offer in that area, in the sense of, these are some critical, these are the most critical kind of pieces of the program. If you have to engage in cut, obviously I don't expect that somebody's going to volunteer cuts. That's not a reasonable request of you all. But it is something that's important to know to the degree to which you have priorities. And so, typically, what's actually in the budget is an internal discussion, so we can certainly get from our stakeholders their priorities. We can be articulating in our discussions with Division of Budget and others what we believe the prioritization ought to look like. Ultimately, there is a single budget published for the state of New York that we fit into. And so, we fit into that. So we're typically not in a position to say, this is in December, this is exactly what the budget will look like in January. That's just not something that we're kind of permitted to do. But we can certainly get from you and say, if you need to make a cut of X percent, the budget call letter said 5%, here are some things that are the most important things in the program to us. Crisis intervention is more important than X. I just mentioned crisis intervention because you just mentioned it. Not to presume what the answer to the question is. Yeah. So that'd be something I might ask for you guys to think about.
Yeah, and if I could just
Roger,
add really quickly.
This is Abiba. I just wanted to take a moment to clarify Aaliyah's statement, because I see a lot of chatter in the chat box about whether or not the withhold on self-direction has ended in terms of the 20%. And no, it has not. The 20% withhold as it pertains to the 100% funded components of self-direction still remains. What Aaliyah was referring to was the hold on total service amounts. I think that we had shared with folks back in May when we conducted the self-direction webinar that there was a hold on total service amounts because we really wanted to make sure that we were focusing on health and safety for folks. There were a number of flexibilities granted through the Appendix K that folks were taking advantage of. And so there was a hold on total service amounts. That's been lifted, but the 20% withhold still applies as initially communicated.
Abiba, to add to that question, will that be affecting when you draft a new budget?
I'm sorry, Aaliyah, can you kind of cut out, will that be affecting?
Oh, sorry, I'm sorry. So will that 20% withdraw will affect when you make the redo the budget or the budget anniversary?
My understanding, and Kevin, maybe you need to jump in, is that it will impact the 100% state dollar funded components such as OTPS and I think FRR at this point.
Yeah, that's correct. Yep, that's correct, Abiba. It's not meant to limit anyone's budget amount if they're looking to change or expand supports or services. It's, whatever the state is getting invoiced for through OTPS or family reimbursement, we're able to only pass along 80 cents on a dollar, at this point. And I think that's why, many people continue to advocate for some more definitive planning, which we're still working around about, a final cut so that we can then pay 100% of 80% instead of 80% of 100%. But this is Roger has said, is a cash management tool for the short term for the state. And, it doesn't affect anyone's budget planning or anything like that at this point in time.
So should I understand that the OTPS, which is just 3,000 of the self-direction budget, that will be dropped down?
Nothing is resulting in that being permanently dropped down. If we have an OTPS invoice for $100 from an FI, instead of paying them 100 like we would have before 7/1, 20, they would only get paid 80. Now the goal is, the expectation is that at some point that 20% withhold hopefully would be repaid. But I think, the letter that was sent out, mid-August of this year had asked that FIs and other agencies who are in receipt of 100% state funds to begin to plan as if, there was a contingency in the event that these did turn into cuts. So I can't speculate about the future. Well, I guess that's what I have to do fiscally. But, from our perspective, we are, withholding dollars that we are being invoiced for at this point. So it doesn't mean that if someone's, budget, that we would be reducing it by, I'm trying to do the math quickly, $600 at this point. So they don't have a $2,400 budget. They still have a $3,000 amount in their PRA, but what's happening is the actual invoices, right? Because there's a difference between the budgeted amount, the PRA, and what's actually spent. Not to confuse matters, but where we're exercising that control is what's on actually spent, not on the PRA or budget levels.
Okay, so if the PRA already has an amount left out of the remaining service delivery, it's subtracted out already. So the PRA, there is always some amount left as a PRA versus the service amount. So that are we talking about that will be considered, or is just a billing with the FI?
At this point, it's only the reimbursement relationship between OPWDD and the FI. And then what happens beyond that to the families is a different story that we didn't want to, mandate that, providers either pay 100%, because I think as everyone talked about, there could be, fiscal implications for that, versus only paying 80%. I mean, I think the direction that we can give is that what we get invoiced for will only, we will only pay 80% of. So again, this is just a relationship between the payment relationship when an FI seeks reimbursement for any of those 100% state paid items. But it could mean that they're, withholding the dollar amount, to ultimately the family, but it may not, depending on the, position of each of the FIs.
Thank you so much.
Okay.
This is Margaret. Roger,
Hi, Margaret.
Can we go back for a second to the discussion of how future or impending budget cuts might be handled? We have discussed in the past that it's useful for each region to have some input because regions' needs don't match necessarily. Your suggestion before was that we come up with kind of statewide priorities. Is it at all possible, and Kevin, I know we've discussed this many times too, is it at all possible for us to be given a target dollar amount for a cut and come up with recommendations ourselves regionally to meet that target? Or if not regionally, then statewide, but at least for us to have some meaningful input into this.
Yeah, that's ideally where I'd like to be. My lack of guidance to you is because I don't have any clear guidance at this point, right?
Yeah.
Like,
right.
I can, to think of what Roger said, right? If we spend about $400 million a year on, 100% state pay, including ISS, family support, et cetera, everything that Roger listed, that would really mean that we have to cut by $80 million, right? If at the end of the day, we, maybe the way the financial plan works is at the end of the day, some tax revenue income is better than what was projected in the last two financial plan updates. We don't want to be taking that substantive of a reduction against our 100% state pay and, make it look like we made it easy to help reduce spending in this area. So I think part of our struggle on that one, Margaret, is that we really don't have any clear definitive answer on what will be asked of agencies. I think when I referenced the call letter, it was a minimum of 5%. Right? Meaning that's the best case probably scenario. And, worst case could be, who knows, 20%, like kind of where the targets have been recently. So that's what's kind of been in making this a little more difficult. Like if I had some direction, not from anyone on this call, clearly it's, from other, control agencies, I think it would be helpful for us to begin to formulate a plan. I think in the absence of that, and we may be lowballing it, is what we're trying to do is look at those areas that we're not withholding right now, and then kind of subtracting what we think their annual spending will be from that roughly 400 million. And coming up with a target. We're close to that now. I mean, it's still going to be, a big double digit, number. But what we're trying to do is to, get some external clarity as to whether or not we're directionally appropriate, which is a term that has been used with some of the work that I've done. So if we're directionally appropriate, I think at that point we can work and say, here's what we have to do statewide.
Mm-hmm.
With you guys, with everyone prioritizing the regional needs, where, how much does that get us? Because, this is what it would be with all state pay dollars, right? And then we have to kind of segregate that out by service setting. So do we want to disproportionately go after, say, the room and board supplement that Roger alluded to? Do we, treat everybody equally and say, come up with plans, to achieve that? So it's the equivalent of across the board at a high level, but there's targeted approaches within that to help sustain. I think, I know, in talking with Roger and the commissioner, we definitely want to get there. I think we're just having trouble identifying what the dollar value is based on that. And that's why when we talk about utilization, to me, utilization, understanding how services are being utilized at this point are critical, to informing what we may need to do or not do,
Mm-hmm.
So,
Well, maybe it would
if
be
I could
useful.
just jump in for a sec. I just wanted to kind of walk you back a little bit from specific cuts, because we're not in any way prepared to discuss that. But just to remind you that back in February, when I gave my budget testimony, we articulated, certain broad goals for our system, which were that we make our services accessible, meaning we don't want waiting lists, that we allocate our resources fairly and equitably, and we are going to be trying to move in that direction and use acuity as a basis for allocating resources, and that we also have a system that is sustainable and we can support it over time. Back in February, March, April, we were talking about a 2% across the board cut. We gave a lot of thought about whether that was the right strategy for achieving the budget reduction that we were required to make. We decided at that point that we should focus and prioritize our efforts in sustaining services, not making cuts to services, to sustaining the DSP workforce and not cutting the DSP salary increases that were authorized, and also to achieving at the maximum federal financial participation as possible, and preserving as much capacity as a result. Those goals haven't changed. We still will be bringing that type of approach to analysis of the budget. It would be valuable for us to hear from you if those are not approaches that you would desire, because that will help us develop a budget, identify areas where we want to make investments or where we no longer continue to make investments. But to focus on that right now, I think would be helpful. We're a long way from developing a budget at this point. So let's try to keep that in mind as we're looking at managing this process. Thanks.
Roger, if you're speaking, we can't hear you.
I was very eloquent speaking into a muted mic. I was trying to respect the mute when you're not talking. Margaret, if you wanted to maybe, I don't know if we've covered all the FSS items under number 4 on the agenda, but maybe you can kind of see if there's anything that we've left out in dialogue.
We have not yet discussed service access.
Right, that's the one remaining item on the agenda, service access. But I wanted, before we go to that, I wanted to just clean up a little loose ends here regarding the priorities. Maybe it would make sense for us to develop, to each go back to our regions and try and prioritize the family support services that we feel are essential for the regions. Maybe there will be substantial overlap. Maybe it will be a useful exercise, maybe not, but it could turn out to be very useful. So if people think that's a good idea, we could try and do that pretty quickly.
I would say from an OPWDD perspective, that would be super helpful. I mean, there's two possible approaches, assuming there does need to be some reductions in this area. And let's hope, you know, the answer to that is no. There's one which is some kind of statewide approach. We're no longer paying for category X of spending, right? You know, something of that nature, and that generates the needed savings. Or there's regional targets, or so on, right? So getting the priorities, whether on a regional level or on an aggregate basis, I think would be super useful. And you know, there's nothing unique to this conversation. There's obviously, this is a conversation about the FSS program, but this is exactly the kind of conversation we're having with other stakeholders and other fora.
Mm-hmm.
You know, stakeholders who may operate residential programs, stakeholders who may operate day services programs. What are your priorities? And that's, you know, that's the nature of budgeting is priority, you know, prioritizing.
Yeah. Okay. We can do that.
Appreciate it.
Okay.
Thank you, Margaret.
Thank you. So now to go back to Gail. Gail, do you want to state your question about the service access?
I was just curious. There had been talk some time ago. CCOs are now helping with eligibility. There are certainly still some FSS contracts that include service access. Their numbers have dwindled, but they still have a population that they are serving that don't necessarily want to work with a CCO. I'm just curious if there's any further discussion about transitioning those services or what their future may look like. And I also had a question about managed care planning and how that was going.
Okay, so why don't we do them one at a time? On the first, Abiba, I'm certainly not aware of any action in that area. I don't know if you are.
Yeah, I mean, I think it goes back to what we noted a couple of meetings ago and what Kevin recapped for folks early on. I mean, as we look at the contract, I think we have to seriously evaluate where we see duplicative services, right? I understand that folks don't want to work with a CCO all the time, but certainly if you look at those eligibility contracts or those service access contracts, as folks to refer to them as, and we have the CCOs also helping with that task, I think we have to look at that, right? I think we noted early on that any of the contracts that are duplicative of other supports and services in the delivery system, waiver services, et cetera, would certainly be on the table for us to look at and see whether or not it makes sense to continue those contracts. So they are under review. Have we made any specific decisions at this point? No, but we are reviewing them and reviewing them closely.
Right, and so I think that the point being that could be one of the prioritization criteria if we needed to achieve some fiscal savings in this area. We could say, you know, those services that tend to duplicate what CCOs may also be able to render, which is a Medicaid matched service, you know, might be one that we may give a statewide centralized direction that would be eliminated. But that's, you know, that's up for decision making. Thank you so much, Abiba. On the second question, sorry, Gail.
Not necessarily eliminated, because there are folks that do not want to work with a CCO. They don't need waiver services, and so forcing them to go that way would put undue stress on just another system and, you know, overpopulate that so people can't get their services. I don't think that would be a savings. So I just want to put that on the record, not necessarily eliminate, but significantly reduce, because there is definitely a duplication in that service. But I'm sorry.
Sure, thank you. That's an important clarification, Gail. Thank you. In terms of your second question, you know, I think as folks are aware, we put out a revised qualification document for public comment. I think we put that out middle of February with a return date for comments sometime in the middle or late March. Obviously, you know, there were some other things going on in that time frame, and so I believe we extended that comment deadline twice just to accommodate, individuals and families and various other stakeholders who certainly were focused elsewhere. That comment period closed sometime in the middle of June to late June. And, we're taking a look at that and really charting our next steps. At this point, we don't have a specific timeline on that, but that's where that's kind of where we sit as of today.
Thank you.
Absolutely. Any other questions that I'm just trying to scroll back a little bit in the chat room just to see if there's anything that, I missed. Let me just ask you, Margaret, do you say anything from the committee or from your perspective of things that should be raised?
There's nothing that I can think of at pertaining to the agenda. I would like to say something, a general statement though, if I may.
Sure.
Okay, so I wanted to thank Nick and Alexis for coming today, and I'd like to share that we have been long wanting a liaison for our committee, and we're very happy to have you and happy to work with you. And also commendations to OPW for the captioning and for the sign language provision. It's wonderful to have that. I realize it may not go so smoothly at first, but it's a very good direction to go in, and I think that's much appreciated. So thank you for that.
Thank you, and we are going to be including this with respect to sort of any major, public meetings as a matter of course. Obviously, folks in smaller meetings can request that to be assistive, but as a matter of course, when we're doing these kinds of, public meetings, that will be a feature because it's obviously. It's incredibly important to be accessible, and it's even more important when you're a disability serving agency to
Yes.
make yourself accessible to people with disabilities. So,
Right.
So thank you for that. I would say that just in terms of previews of coming attractions, if you will, for aficionados of OPWDD sponsored public meetings, we should be getting out an announcement soon for a couple of webinars, one during the day and one during the evening on the 12th, so next Thursday. That will accompany on Wednesday, we will be releasing the latest and greatest waiver amendment. So as we've talked about in a number of places, we currently operate under flexibilities afforded to us by the so-called Appendix K, which have emergency flexibilities, services, as well as the community habilitation and the residents, the ComHab-R. The current Appendix K expires March 31, 2021. There's a federal policy that says an Appendix K can last 1 year and only 1 year. So we have developed in collaboration with some stakeholder outreach engagement back in the late summer discussions, were these flexibilities useful? Were they not useful? Was the fundamental question. And in the main, people indicated to us that they were quite useful, quite helpful to families and individuals, quite helpful to providers in being able to render services in new and innovative ways. So we're going to be proposing to make permanent those flexibilities that are, once again, in the telepractice and the ComHab in the residents. And that would be hopefully approved, but there would be a public comment period and a review, a webinar so that people know what's going on, and then discussions with our federal partners about a potential approval. So that's something that folks should see an announcement on in short order, but since we had about 300 participants as well as the panelists, I thought I would mention it. It's something I think that we're pretty excited about, to be able to, do some things that we didn't think about back in February, and then we all innovated together and now we have an opportunity to maybe to make them more permanent features of our service system. So with that, I will bid everyone a wonderful rest of your afternoon. Be safe and be healthy. Take care.